homes?
Yes, thank you so much for that. So from the homes, the parents are, their kids look up to them and they pick up habits from their parents. And, they really play an important role because from at home, they can or they should tell their children, okay, these are habits that you should, pick up. And there's something going on right now to not get infected. You should wash your hands properly. You should make sure that you're not, taking water from your friend. You don't know what the source is. They don't just get food from food vendors or areas that don't look clean. So these are the parents' role, really. They have to educate their children and tell them that this is something that they need to do to prevent them from being infected. And also, when they notice symptoms, there's also the oral rehydration solution, which parents can also do to give their children to reduce the rate of dehydration. That is before they get to a hospital. And there's also ORS sachets that are being sold. So these are ways that parents can also come in to help their children, overcome this.
Right. I like the fact that you mentioned the matter of symptoms if they notice. So what should parents look out for in their children to be able to quickly identify that perhaps their child has contracted cholera as it is, and then what steps they can quickly take?
Okay, thank you so much. So we know that cholera is practically a diarrheal disease. So it mainly presents with diarrhea, that is watery stool. So when you notice that your child is having multiple episodes of watery stool, it could be, a sign that, okay, you need to do something about this. And it has a characteristic stool, which we refer to as rice water stool. It looks like the rice water after parboiled and, washing. It has that typical characteristics. So that is one way. When you notice that there's frequent stooling, some could also present with vomiting. And then over time, if it starts getting severe, there's now signs of dehydration because the body needs fluids. So when we lose them in excessive amounts in a short period of time, it affects the body, and it could even lead to death in hours if not managed properly. So it's important that when a parent notices this in their child, they do something about it by going to the nearest health center or hospital to seek medical attention. So those are the main signs. For dehydration, depending on how long the child has been passing this loose stool or vomiting, there could be other signs, lethargy, there could be sunken eyes, and just weakness and all that. So those are signs. But the main thing to look out for is the diarrhea. But still, there are lots of about 80% of cases actually don't have 80% of cases actually are asymptomatic. They don't present with symptoms. But with children, they most likely would present with symptoms. But it's important to do something. Like I mentioned, the ORS. People can even do it like by themselves at home by getting a liter of water, bottled water or boiled water, and putting 6 teaspoons of sugar and a half teaspoon of salt, and then mixing that, and you can give your child to replace the fluids that are being lost through vomiting or stooling.
And from your point, you said that 80% of cases are asymptomatic.